Good afternoon. I'm Tom Stoll, Sedgwick County Manager, here for the weekly update regarding COVID-19. Today's June 24th, 2020. Very quickly to go through the numbers. In the United States, our cases went up 2.6% since Monday. Our totals for today are 2,348,956. In the state of Kansas, we went up 4% since last Monday. Our numbers today in the state are just short of 13,000. So we have 12,970. In Sedgwick County, since Monday, we went up 6.9%. So we went from 896 to 958. And I'm going to get into the county statistics a little bit more. When you compare our weekly numbers from last Wednesday, which would be June 17th, to today, June 24, we went from 810 to 958 cases. Our recoveries increased from 514 on June 17th to 619 as of today, and our deaths went from 25 to 26 in the weekly time frame. The periphery counties, Harvey County is up to 26 cases. Butler has 52 positive cases. Cowley has 61 positive cases. Sumner with 10, and Reno County is up to 67 positive cases. Just some updates from the County Health Department. The mobile testing team will be in Clearwater from 9 a.m. to noon on Thursday, June 25th at the Senior and Community Center, which is at 921 East Janet Avenue. Sedgwick County's random sample survey will continue through the end of the week. I'll talk more on this in just a little bit. Participants will be tested for COVID-19 at no cost as part of this random sample survey. The survey will help the health department determine the spread of the disease in the county. Phone calls for those who are being solicited to take part in this testing will come from a local 660 prefix number, which is the county's prefix. As continuing, our residents are able to be tested for COVID-19 regardless of symptoms at no cost through the health department. More than 25,000 Sedgwick County residents have been tested for COVID-19, and 202 residents were tested today. To start this process, please call 211 if you think you should be tested for COVID or if you have general questions about COVID. It's still the starting point. So as I mentioned last week, and I'll just repeat it today, there's three kinds of testing going on right now. One kind of testing, but three kinds of people, right? We have those who are symptomatic, those who are sick, who are displaying one of the many symptoms that COVID is manifesting itself in. Those people are highest priority in the health department testing. Our numbers are trending up, as we can see, so we anticipate that people who are symptomatic, those numbers are going up slightly, and so we need to test those people first. That's priority number one. The last priority number three, is those who are asymptomatic, who are curious if they have COVID or not. And in the middle is a group of people that are asymptomatic right now, but maybe have had close contact with someone who is COVID positive. So as the health department is trying to manage all this and schedule this, those who are asymptomatic, who have not had close contacts, need to be patient. It could be days before we can put you in to be tested. So understand that going into the system. If you have health insurance, there are other options in the community for testing. Check with your local doctor's office, and we will, on our website, going to begin to modify our testing center capacity that the community has. So look for something on our website very soon where it will have a listing and a address and what the rules are, whether you need money or not, whether you have to have an office visit or not. We'll begin to publish those kinds of information to help people get tested, because we understand this is going to continue and perhaps increase through the summer. So please be patient with the whole system. The health department is working very hard. I don't think I have to mention that. This is since the onset of the pandemic. It changes weekly. It's a very dynamic situation. So please understand that when you call in for testing, there may be a bit of a wait. If you're asymptomatic, there may be a significant wait, but please be patient, understanding we're trying to take care of symptomatic people first. As I mentioned before, the health department has a mobile testing unit that visits different cities in Sedgwick County. You can test symptomatic or asymptomatic at that site for no cost. Appointments would be nice there, but if you feel like you have to go, we will take non-appointments there. But clearly, we're trying to avoid long lines and respect people's time. So anytime you can call for appointment, that is always recommended, just to be efficient with people's time. Thus far, we have visited Clearwater, Mulvane, and Valley Center so far. Today, the commissioners, we had them scheduled for COVID testing last week as part of the kickoff to the random sample test. They did make it in today. Several of them made it in for testing today. Several of them have it on their social media as they went through the process. Please recognize that our elected officials have gone through that. I know the mayor on the city of Wichita side has also. Our random sample testing, we had a lot of people just did not want to take part in that. So we will have numbers, probably not the 1,401 numbers that we wanted. And that's okay. I mean, we learned through the exercise that that's not popular with the community. What is popular, though, is asymptomatic testing. We are getting a lot of calls, both for our West Central location and for our mobile location for asymptomatic testing. So those numbers are very high, and we're trying to manage that and have added staff recently to manage that more efficiently. And we're always going to look for ways in the future to get better. Always going to look for ways in the future to be more efficient, to respect people's time, and to make sure we don't have failure or long lines to make people wait. So we're continuing to work on that every day.
Deborah with KMEW.
Hi.
And I was wondering if when will you receive the results from the commissioner's test today, and will you make that information public?
That's a really good question. We'll get results back from them anywhere from now until several days, because when we do the asymptomatic testing, we do not send those samples to the state lab. We send them to one of two contracted labs, so that turnaround sometimes takes a bit longer. So we'll get results back just like any normal testing procedure. That's a good question on whether I think that's going to be up to them. People's medical information, and some of the commissioners have been very forthcoming on their process today. We clearly don't want to be in a position where we embarrass citizens or put information out there that they don't want us to. So I'll have to defer to the commissioners whether they want to release their data or not.